This is Alex Shepley for class 156. I'll show you around the room. The first thing I would do would be look for a doctor's order, check the patient to see if they have any allergies, and then I'd assemble my equipment. Here, these are my alcohol pads. I'm using these as my vials. There's a Benadryl for my oral medication. I'm using orange for injection, and this is my MAR. So after I assembled my appropriate equipment, I would wash my hands, and this is my drug room, so it's a no interruption zone. And then I would look at the MAR for what medications I needed. The first one I'll prepare will be the oral medication. So I would compare oral medication to what was here, grab the appropriate one, make sure the dosage is correct, and that the medicine is not expired. And after that, I'd place the medicine inside medicine cup inside the package. So next, I have a subcutaneous injection. So we'll do insulin, and I will do that out of this. So the first thing I would do would be to clean the top off with an alcohol swab and let that dry. Select the appropriate needle size and pull back the plunger to the appropriate amount, checking the MAR to see what we need. Look at the vial, make sure it is what we need and that the medicine is not expired. So then we would needle, puncture the vial and put air into the vial. Then we would flip it over and pull out the correct amount. Okay. All right. So then I would label this with the patient, my name, and what it is. We'll set that there. For multiple types of insulin in the same syringe, we'd pull back the syringe for the amount we needed total, and then clean both of the vials again, place the syringe inside the intermediate, and inject the air, and then the half of that air, or the amount that we're taking out of that vial, pull the syringe out, put it inside the regular insulin, put air inside that, and then we would pull back the right amount for the regular insulin, and then pull back on the type for the intermediate insulin. So next, we'll do the intramuscular. For that, we will use this vial, clean it off appropriately, check the MAR to make sure that is what we needed, and the medicine is not expired, and the dosage, confirm that. So then we would administer this. I would pull back the syringe to the amount of air that I'll need for the injection, and then push it in to the vial and inject air, and then flip over and pull back the correct amount. This would be in a package normally. Then we would just put So the next thing I do, I'd label this syringe with the time and my name, the patient's name, and what it is, and then I'm just going to go ahead and make sure that my dosages are what is ordered for all the medications. So then, before entering the patient's room, I would check the MAR sheet again, making sure I have the right patient and the right medications. So I'd knock on the patient's door, introduce myself, identify the patient with their wristband, and I'd ask them their name and date of birth, and compare that to the MAR sheet. Then I would explain I was there to administer medicine and give an example or give a description of what each of these medicines are and where they would be going. So I'll start with the oral medication. So for the oral medication, first I wash my hands and I'll put on clean gloves, and then take the oral medication and tear it open and pour it into the cup. Give that to the patient and make sure they swallow it. Have them something to drink. If the patient needs their pills to be split or crushed, we have to make sure that the pill can be crushed or split, and administer it that way. If the medicine needs to be dissolved, we can put it on top of their tongue and advise them not to chew it or swallow it until it is dissolved. If it needs to be buccally, we could put it inside their cheek or next to their gums and wait for it to dissolve, or sublingual, we'll put it underneath their tongue and let it dissolve. If it needs to be dissolved in water, we just mix it into the water and watch the patient drink that. If it is a liquid, we would set the cup down and pour the liquid in at eye level to the appropriate amount, and let the patient drink that and sit here while they do that. So after that, we'll do the subcutaneous injection. In this case, I'm using insulin. We could give that into the patient's butt or in their stomach, which would be 2 inches from their belly button, or we could use the back of the arm. For this, I would use the stomach, which would just be 2 inches or 2 finger widths beneath their belly button. I could palpitate the area and check the area for bruising, edema, or inflammation, or redness, and make sure the patient hasn't been injected in that site recently. We're going to rotate the site so we can give it. So for this, I'm going to use my orange. I'm going to take the cap off. I'm telling the patient they're going to feel a slight pinch. If they want me to count to 3, I would do so. So on 1, 2, 3, stick the patient and slowly inject medicine. And pull it out. I could have pinched and then injected and then released, depending on the patient. And then just stick that back in there. So next I would do the intramuscular. On the intramuscular, we could use the thigh. So we'd put 2 hands here and our thumbs would come together, and that's where we would do that. We could use the deltoid, which is 2 finger paces away from their shoulder notch, which would be right about there. Or the ventrogluteal, which we could put our hand on the hip and make sure our thumb faces the groin and the fingers back, and then 2 fingers here, and that's where we give our injection. In that case, I'd find where that spot is, clean it with alcohol. I should have done that with the insulin injection. Wait for that to dry, and then get ready for the intramuscular injection. So in this case, I would pull the skin taut and count to 3. 1, 2, 3. Inject the needle. I would pull back on the needle to see if there's blood, and if there's not, we could continue with our injection. Okay, I'll hold a gauze pad there. We'd activate the safety on the needle, and then give the patient a Band-Aid. Put the Band-Aid on. So after all that, I take off my gloves, wash my hands, assemble all my equipment to take out of the room, make sure there are patient's call lights in place. If they needed anything else, lower the bed, put the side rails up if needed, ask them if there's anything else they need from me, and then I would immediately document the time and the medicine that was given, the patient's tolerance. And that's it.